Hi, everyone. Welcome back to our regular viewers, and thank you for joining us for our fourth episode of the season. If you are new to our podcast, a new peer ally, or new to the workforce, we're glad we found you. This podcast is for behavioral health clients and consumers, advocates, allies, peer support workers, community health workers, and community stakeholders, where we talk about advocacy, recovery, peer support, and provide education related to legislative changes to statewide policy to empower you as a client, consumer, or ally to lift up your voice as a stakeholder in the public behavioral health system. With me today are my fantastic teammates for Access California,
I'm Jocelyn. I'm Grace.
And I'm Marco.
and I'm Nicole. Joining us today are two representatives from our Access California Superior Region partners. Ida Moore from Sunrays of Hope in Modoc County,
Hi, everyone.
and Don Morrison from Youth for Change in the Sutter, Yuba County area.
Hi, all.
The Sunrays of Hope is fully committed to empowering its peers and community through education and support needed to gain overall wellness. Sunrays of Hope strives to provide the best accessible and acceptable county population services using culturally and age-appropriate material to maximize wellness and recovery. In partnership with local community agencies through a contractual agreement with Modoc County Behavioral Health Services, Sunrays of Hope provides peers, community support, referrals, training, activities, and socialization. Youth for Change is a diversified private nonprofit dedicated to enhancing the well-being of children, individuals, families, and communities. They are inclusive, caring, and a resilient agency that works from a set of core values that allows them to deliver trauma-informed, culturally sensitive, and client-centered services. We asked both Ida and Dawn to join us to share about their programs and all things related to advocacy and reaching rural communities. So let's get right into it. Ida and Dawn, can you please share a bit about yourself and your journey to this work?
Okay, I'll go first. So in Arizona, I had received services. I have childhood PTSD. A lot of my parents were very caring and loving and new to being parents, and they did their best to protect, their children as much as they could. But of course, family members and other things came into. So I've had received services. So I'm also a person with lived experience with mental health issues or challenges, which also led me to substance use challenges, which led me to judicial system and also homeless. So I have this lived experience that I brought to Alturas, California in 2009. And didn't realize, that there was a wellness center here, or, everything. It was, deal. True them, but so anyways, in 2009, came down to Alturas, California. It wasn't until 2010. My son's friend, his mom was working for Sunrays as a transporter. And we got to talking and found it, hey, I'm here. I'm a person with lived experience too, and I would love to give to the community and also, share this hope, the hope that we can all recover and be that model, that role model that, you can overcome these challenges. So I started as a transporter, as then an operations manager, got into with Modoc County Behavioral Health, part of the prevention collaborative, outreach, community, also the cultural competence committee, just really putting Sunrays as well as myself and getting Sunrays participants in a lot of the community committees so that we can, provide the resources and also understanding of what the resources are within our community. So when we do have a peer to come in, then we can, I'm sorry, I'm going off on a tangent, I'm getting a little too deep there. But as it started, and so commitment and seeing others that had the same commitment as I did, and lived experience. And now I'm the director there, been there since 2010. And just really love it. And just looking forward to, being able to provide more services and bringing more education, awareness, and not just mental health, but suicide awareness, and also harm reduction, what we can do, also to help our peers, and not just the peers, but our community in general.
Thank you for sharing your story, Ida. And it's important for us to be able to have these conversations with your lived experience and expertise and what you bring to Sunrays. Thank you.
Thank you.
S- I grew up in Livermore in the East Bay area, Northern California, and like so many other families, I believe, ours looked normal on the outside, um, and had its challenges on the inside. There were family members with some mental health and substance use challenges in the house, and um, it was much, much later in life that I was able to look back and see, oh, at about that age, those were the first signs of depression, first symptoms. And I didn't know what was going on. And of course, you're a kid and you're having these kind of symptoms and you think you're defective. There's something wrong with you. And so, and even if you're not even aware of that feeling, it stuck with me throughout, my childhood, adolescence, young adulthood into, maturity. And so, yeah, I went through that proverbial long, dark tunnel and, occasionally receiving services, occasionally talking to a counselor. I have my issues with substance use. And I finally finally, after addressing all the causes and conditions about 5 years ago, made some major life changes, and I was living away, actually on the other side of the U.S. in New York, upstate New York, and moved back to Northern California, and I got a job doing disaster case work for a nonprofit agency. We were assisting people that were still waiting for some help from the Paradise campfire that was in 2018. And so that job ran its course, and my current job just basically fell in my lap. This agency that I work for, Youth for Change, they had an opening for the supervisor for their peer support program that was contracted to Sutter Yuba Behavioral Health. And I interviewed and got the job, and here I am with all of you today. Very grateful.
Well, thank you both for sharing, and thanks for your vulnerability, just kind of sharing about your background and your stories. We often use the phrase lived experience, but really we often prefer the phrase lived expertise, because we recognize that that's really what you're bringing to the table with your stories is a lot of knowledge and a lot of expertise. And yeah, we're just grateful that you're here and that you're sharing with us and that impact that you're bringing. So would you guys be able to share a little bit about your programs at Sunrays of Hope and Youth for Change, and then your roles within those programs and teams?
Okay, I mentioned I work for a nonprofit community-based organization called Youth for Change. Next year, the agency will have been around for 35 years. And it predominantly does serve children and youth, as the name might suggest, although my particular program does serve adults in one of its facets. Um, I also mentioned that a program that I supervise is contracted to Sutter Yuba Behavioral Health. Sutter County and Yuba County, they actually they combined for their behavioral health program. And this we have a staff of peer support specialists that are in actually 3 different programs in Sutter Yuba Behavioral. One is the Wellness and Recovery Center, which is, as most folks might know, it's an adult outpatient center for those that are or have experienced some serious mental illness. And we have 5 certified peer support specialists, including me, in that program. And we have a parent partner who assists parents, family members, and caregivers of children receiving services in what's called the CSOC, Children's Systems of Care program. And we also have 2 peer support specialists in the Sutter Yuba's TAY program, which is transitional age youth. For them, it's age 16 to 25. And so it's interesting because we have people doing different things, and it actually keeps my job interesting. Everybody is certified except one person that really is part-time and does some other kind of work. But so everybody has been through the certified Medi-Cal peer support specialist training and certification. And we are in fact billing Medi-Cal as we speak. Thanks.
Great. Thank you, Don.
And so mine's with Sunrays of Hope Inc. And we have been around since 2009, providing services within the community. We do a lot of transportation to and from the center. We are contractual agreement through Modoc County Behavioral Health to provide a wellness recovery / drop-in center. It is 100% peer ran and also governed. Our board is 100% peer. I am now the director. As I mentioned, I had started as a transporter, went to an operations manager, and now I'm the director of the center. I do sit on the board. We also report to Modoc County Behavioral Health Services on a monthly basis on the services that we provide. So our main focus right now has been really geared towards getting a lot of services provided for our homeless here. We don't really have a very large amount of homeless population, but nonetheless, 21 people in our last point in time count. It's still a population that is underserved and not being served within the area. Our nearest, what do you call it, shelter, sorry. The nearest shelter is like 186 miles away, which is Reading. And so if some people end up going back down there during the winter times and come back, in the summer. So a lot of our services have gotten geared towards helping our homeless population. We created a pantry. So now we're part of the referral process, the local referral through public health. On being able to, for the community, someone in the community, if this service is needed, to be that resource for them. We do a lot of educational, really self-help for the individual. We like to empower people to make the changes, and we use our lived experience to just provide them an understanding of, well, for that hope that, things can be different, and yes, choices and options, we do our best to provide that. And in the end, we, we're the client. The client is the best, not even client, peer. Peer is the author of their story, and they, are the best to know what services work for them. We have also, since Medi-Cal Peer Support Services has been now, billable, we got the certification. We have been able in our area to provide that for 11 peers. We do have peers working in Modoc County Behavioral Health. We also have peers within our Sunrays, but we also have peers that prior to when it became, you know, a billable service and certification, all these different, like, you know, you had Recovery Innovations, you have CASRA, and you have all these other agencies that were providing peer support training. So we have peers that are trained in peer support, but in the center itself, we have maybe 3 that are certified peer support specialists, including myself. We provide RAP, which is a recovery action plan at the center. And we do a lot of self-help, but we do a lot of educational, like we just not too long ago did a training on what the community planning process is and the importance of, you know, partaking in that so that we can have services that are geared towards what we need within our community and not what others may think we need. So which was an awesome turnout, really great. And now we're just waiting to diligently to see what that, you know, 3-year plan looks like, which we actually, within that 30-day process that it takes for it to, for review, we keep a copy at Sunways and we review it with our peers and any questions that come up. And we work on, I mean, really a lot of self-help, self-advocacy, and we do it through community peer bridging, we will, or, you know, the warm handoff, you know, and what referrals within the community will, you know, help that person.
Yeah.
But yeah, thank you. So
No, you're all good. Thank you so much, both of you, for sharing. I know my team already said it, but we really appreciate having you here, not only to share your personal lived experience, but the mission that you're using to serve your communities and all the sectors, you know, the advocacy, the education, and the peer support and the recovery. So thank you both so much. And having worked closely with both of your organizations, we have personally learned more about some strategies for serving rural communities. So can both of you share a little bit about that?
So for us, it seems in the rural area where we're at out here, transportation is really a big barrier. So we provide, again, as I mentioned, transportation to and from the center, and Alturas is the county seat. But we also provide bus passes. So once they're here, if they have to go to, like, say, the other local in town, which is Cedarville, which is 20 minutes away, then we'll provide them that bus pass so they can go and come back, or even to a grocery store, and, you know, the stores here, bus pass. We also, another barrier here is we're barely getting 5G. I mean, everyone has it. Internet is spotty. If anything, you know, if we ever have it, cell phone is also another thing. And we have a really poor population, I should say, very, yeah. And so we also provide like there's the True Connect, which is the California Lifeline phone. They come out here, and they'll let us know when they're here, and we, you know, get peers and, you know, people within the community that are needing that service, and we'll provide, you know, that transportation to that, or if it's even, yeah, it's just really geared to trying to, um, kind of knock those barriers out of the way and get, you know, even if they're able to be able to do telehealth and they can't come in because of the winter, you know, weather, we get snow up here and sometimes it's, I mean, just to share, I mean, we even had to have a sheriff go all the way up to the mountain because there was one individual that we couldn't get to and nobody could, but she was able to call. And we were able to get the sheriffs to go up there, and they literally, I mean, it was a rescue mission, but we got her, she was saved, and that was, you know, so there's constant, you know, just really trying to overcome those barriers so that, you know, services can be accessed. And
Absolutely. Try to meet their basic needs, you know, that are met in a lot of different areas of California, you know.
For us, the challenges in reaching clients in rural communities, well, yep, I'm working in smaller population counties, and they're basically considered rural by the state. I think the budget has a lot to do with it. For instance, in the Sutter Yuba combined behavioral health system, there's only one wellness center. And contrast, Butte County, the next county up, which is actually where I live and where Youth for Change is based. And it's about double the population. There are 4 wellness centers spread out. So yeah, I think smaller population counties, they don't have the budget. And so it's hard to get folks that are outside of bus system to get them in. We do what we can. We also do transport. We bring people in from group homes and whatnot. We send 3 vans out on 3 days a week and 2 vans out on another day. And there are some folks that come in by bus or bicycle or however they can get in. But I think also in reaching clients in rural areas, I think something that is a barrier is also just the general awareness of the prevalence of behavioral health conditions. Not everyone's just aware that, hey, maybe me feeling depressed all the time, maybe there's something that can be done about it. It's not just me. Um, and I think stigma plays a part here too, that it's some cultures, and it's a cultural thing as well. Some cultures may not want to even acknowledge that there is such a thing as mental health challenges, or that it's a sign of weakness to seek treatment for recovery from mental health challenges. And then also, a barrier for clients accessing services could be just a lack of knowledge of who to call, what services are available, where to go, what to do.
Yeah. Thank you so much for sharing, Don. And all of that is so important. And we haven't really talked about that, but just the prevalence of knowing that there's an issue going on, that's not as common out in rural communities. So thank you for sharing that piece of that. So I guess I'll ask both of you, how do your teams ensure that advocacy is integrated into your program for your participants? And what does that look like?
So for Sunrays, we incorporate a lot of, so when we come back from our cultural competency meeting, we're part of the transportation committee, the prevention, the outreach, and we also currently have, her name's Beverly. She was our patient rights advocate here in Modoc County. But since recently Modoc County has, went to more of a different agency, so to speak. Well, definitely. But so she comes to Sunrays and she'll provide so let's say when you're going to the doctor, you have all this in your mind that I'm gonna ask this doctor this and this and that, but once you get there, we're like, nothing's wrong. So we provide material to like, hey, when you're going to go to your doctor's appointment, here's maybe jot down some of these questions of what you were thinking of and, what's been ailing you. And then when you get there, take this with you. And if you need help, or need someone to go with you, you do have that right, that someone can go with you. Really making our peers, the community, where that you do have rights, and we educate them on that. We also, if they have concerns and it happens to be something with their clinician and that kind of behavioral health, well then we can provide them the information they need if they needed to like change a provider, which, they have that right to be able to do so. So, we educate them on that process too. Also keeping, of what's happening, in our outreach or even the prevention collaborative and how to be part of the community and advocate for others as well, is because that's our goal is once you got that empowered to learn how to advocate for yourself, then we hope that, we share that and provide that to, teach others how to advocate for themselves as well. So within Sunrays, advocacy does play a big role and we do our best to teach, to empower them and to teach them how to do it in the right way, not, and I get emotions can come out and, then there's just blah and no one's listening. So we do our best to educate them and, provide them, the material and the knowledge that, they need and that support. If they need us to go with them, whether it be a court date, whether it be, whoever's available, even myself with my busy schedule working at Modoc County Behavioral Health and at running the center and I mean, we're just really community working together to provide that support and advocacy and knowledge on how to do it well.
Yeah, for sure. Thank you, Ida. That was worded so well. You said it perfectly.
For us, our wellness center is not a standalone building. It's actually in the main behavioral health building of Sutter, Yuba County. And so our participants, and we have at any one time, we have in the wellness center maybe 35 or so active participants, of which, there might be 18 to 25 show up on any given day. But a lot of them have case managers and therapists or counselors, and they're literally right down the hall. And so as far as us advocating for our participants, then we have communication open. We have a specific, two specific chats made up out of the Microsoft Teams app. So, and also in our weekly staff meeting, we have our clinical supervisor for the FSP program. With that, a lot of our wellness participants are in that. And so we're able to share information on the individual participants. If somebody needs something, if we notice new challenges, or also we share successes too for these particular participants. Now, as far as working on the participants' self advocacy, that starts with treatment plans. I think most other peer programs, at least that bill, will create a treatment plan for each participant. We do that in the Wellness Center and also for the parent partner and the TAY peers. And most of the participants, most of the folks we serve, probably will say somewhere in there that they wish to live independently. And so with the Wellness Center, we have a variety of groups, but we try to keep a mix of educational, and that would be where they could learn more about recovery or specific challenges so that they could speak more confidently when they're working with a professional, and also skill building groups, cooking. It's escaping me, but like personal finance. And also just fun groups, bingo, table games for socialization, which is helpful in these individuals' recovery. Same thing with the TAY peer support workers. They work with they call them students, the 16 to 25-year-olds. They work with them on general basic living skills and education. And in fact, for our parent partner, Rachel, who she works with parents or caregivers of younger ones that are receiving services, a lot of times that parent's voice is not always heard by the treatment team that's working with that young child. And so part of her service is to make sure that that parent's voice is heard and that parent is advocated for as well.
Thank you both for sharing.
Yeah, absolutely. Very inspirational, Don, Ida. Thank you so much. And all around me, I'm sensing that there's a message that it takes a village. It does take a village to lift up and overcome, to listen to these challenges. And I'm wondering if you wouldn't mind sharing what strategies you've employed to overcome these obstacles and empower individuals to actively engage and advocate for themselves.
Again, the groups, the education, the skill building, all should build towards helping a person be able to uh, strive to live a self-directed life, which is part of that SAMHSA definition of recovery. Now, the obstacles of actually accessing services, especially in these rural type communities or regions. The county behavioral health system, lately they have performed more outreach in the form of advertising on billboards. They've got a specific warm line set up, something newer, I believe. And I'm seeing that on billboards and smaller signs around the Yuba City, Marysville area. Also, principals from the behavioral health system may go on a local radio show and talk about their programs and talk about how to even access the system. And the county also has physical outreach, of course. There's a team that will go out to homeless encampments and on a regular basis and see to those people's needs and refer them into the behavioral health system if that person is willing to pursue gaining those services.
So at Sunrise, again, here up in Modoc County, the weather and the transportation, even services, just like being able to access the services, whether it be through telehealth or whether it be in person. Again, as I mentioned, it happens with transportation seems to be a barrier, which we work due diligently with other agencies, our Sage Stage here through bus passes and transportation provided through Sunrise. I do know that our FSP through Modoc County Behavioral Health is getting really robust, which is awesome. That means a lot of peers are able to get to their appointments, and it's really kind of taking off a little bit of strain on Sunrises because we're refunding as much, as well. The budget, it tends to eat up the budget, but still there's a need, and we find ways to overcome that. As for advocacy and actually knowing what services are out there within the community, Sunrise does a lot of outreach. We go to Surprise Valley, the hospital there. They have their Surprise Valley health fair. Then we've also gone all the way down to Knoll and Tule Lake at their health fairs, Modoc Medical Center's health fairs. We also do really a lot of outreach engagement and provide material, not just from what the centers got, but also what local agencies within the community. We'll ask them, do you mind if we also put this out? I know that you guys will be there, but just so that, just to, have it out in the event that, let's say, they don't show up, that agencies for some reason couldn't show up, you know. Staffing here is kind of very limited. We are kind of a little understaffed, and, you know, our Modoc County Behavioral Health has a very high caseload, our clinicians do. And I'm speaking on that aspect only as because I also do work at Modoc County Behavioral Health as an administrative specialist. So I get to see the both aspects of both worlds, I guess you can say, the clinical aspect and the peer aspect, and how we can, you know, incorporate those so that our people, the community is really getting the services that they totally need, and, you know, needed out here. So we do a lot of communication back and forth with Modoc County Behavioral Health through like the FSP program. Also, we'll also provide information and education services, not just to those in the community, but we also take it to our clinical staff too. And so we do a lot of actively engaging with the community, the whole community within Modoc. And then I also wanted to point it out, thanks Don for mentioning this, but we're also in Modoc County, between Modoc County and Lassen County, Sunrise of Hope is the only wellness center within these two counties at the moment. And yes, partly because of the funding, but it's also getting the people to want to stay in these rural areas where there's a weather that's the barrier, you know, the cold, it's so, you know, and there's, I mean, a Walmart, you know, your local you know, like stores, your shopping centers, it's, I mean, that's like a whole, 120 miles away in Klamath Falls, Oregon. So Sunrays also incorporates, we have what we call our Klamath Falls socialization trip. So we also take individuals down there so that they can actually, you know, be able to get, because some of the prices have risen, and, you know, especially out here in the rural area, because they have to get the, you know, product in. So of course you've got that travel expense that's stacked on top of the purchase price. So we take individuals down to a community so that they can get, I guess, more bang for their buck, so to speak, you know, because it is, you know, that's just another avenue of how we're trying to help our community, our peers, you know, get what they need and the services they need, and, you know, in the best possible way that we can think of. And advocacy through knowledge, through, you know, lived experience, and providing those choices and options, and being that their support, and walking the road with them, you know, so that they don't feel alone, and is what we strive to do. I mean, and there's always challenges, and together as a group, you know, we work together to overcome those challenges.
Beautiful. Thank you both for sharing.
Yeah, thank you both, Ida and Don. I think one thing that always amazes me about the rural communities is just the creativity and innovation that's involved in these services and in reaching your communities. It's very different than many other regions in California. And I think all of us have a lot to learn from our rural communities and rural region partners. So thank you both for sharing about that. Just kind of to wrap up, is there anything else that you want to share with us? Either updates, developments, anything just we haven't touched on today that either of you would like to share?
Yeah, I'm a relative newcomer to this field. I've been in behavioral health like 4 years. But I would bet that for a long time there hasn't been a county administrator that said, "Oh, we have too much money in our budget." And so the situation appears to be more profound now with the upcoming state requirement that Prop 1 gets implemented by July of next year. So all of that to say, budget is more constricted than ever for certain programs. Some programs are required by the state, some aren't. And the wellness and recovery program is not. Now, the county passed on a mandate to us that all the peers on the staff of our whole peer program, the parent partner in CSOC, the two TAY peers, and the wellness and recovery peer staff, everybody's certified so that they can all bill. And they want to see us bill a certain amount. And of course, I've been wanting to do this for a while so that we can help essentially just pay for a big chunk of our program. And so now we're doing it. We're right in the midst of overhauling the wellness and recovery schedule. And it's sort of a little bit of a tricky dance because we're either adding in new groups that are billable, creating billable groups out of those that wouldn't seem to be billable. Like instead of bingo, now it's self-care bingo. And all doing this while trying to not disturb the level of service that we're able to provide to the community members. So that's actually going on right now, and we're our peer staff. Some of them, particularly the ones in the wellness center, are newer to billing, and so we're coaching them along the way while we're getting our schedule overhauled. Now, the thing about this is that this was not a change that that threw a lot of negative emotions into our crew. What we've kind of done is just look at this as an opportunity to make some changes for the better. And so we're actually looking forward to being able to be around in the future by showing that we can, in fact, the certified peers can pay for a big chunk of our own program. And really, my overarching goal in doing this for a while has been to be a witness to or have something to do with more peer support positions being created in county behavioral health systems, or I should say, particularly these smaller county behavioral health systems. Because there's, I think, a very large potential workforce. There's a lot of us peers out there that would love the opportunity to do what we're doing. And a part of it is giving back in the way that people have helped us in the past. And part of it is because it's good for our own recovery to actually work in recovery as well. On a personal note, myself, a peer that became a certified peer. I got the national certification too, just for fun. But I have just recently been promoted to program manager of peer services.
Congratulations.
And thank you. And I'm hoping that that will, in the near future, include more positions that we can hire and provide for the county behavioral health systems. But so I continue to facilitate groups myself because I like having direct contact with the people that we're serving, and I can show myself as an example of recovery. That's, to me, maybe the highest form of what peer support specialists do is to model recovery. And so that's what I'm proud to be able to do. And I'm actually, despite the new budget constraints, I'm actually looking forward to what the near future will bring.
Thanks, Don. Yeah, there is a lot to look forward to, and a lot of exciting things happening. Ida, is anything for you? Any either updates, developments, or just anything that we haven't talked about today that you want to share before we close?
Yeah, we are currently working. So we have a pair that have went through the Medi-Cal peer support specialist training, got her certification. Also started working for one of the local agencies here, not at Modoc County Behavioral Health, but the local agency. I'm doing peer work. She's also a grant writer. In collaboration with the agency and her, we Sunrise are working on a grant through Costco to further build our food pantry. And also provide, because also the Taste Center. So Sunrise is a standalone. We are not inside Modoc County Behavioral Health. They don't even micromanage Sunrise of Hope or in any aspect. We do have deliverables that we have to, for our contract. And the spending, and that's how we provide, an understanding of where the money's going, and then also the services that are being provided and the people that are being helped, the peers that are being helped. So with Modoc County Behavioral Health, with the changes of the BHSA to BHSA, and the constricts, that are now, it used to be the community service support bucket, which is now going to be the behavioral health support services bucket in the new Prop 1. They So I know that the wellness centers are not really geared so much into that, but in our area, in the rural area, seeing how the FSP, our participants at the center, 85% of them are FSP clients. And we're providing an education, we're providing an employment opportunity, whether it be through a Medi-Cal peer support specialist or providing a training, like even, for instance, we have an individual who is an FSP client, and this individual provides a Spanish class too in the center, so just getting, so for the funding and the changes, I can see that it's going to be, we're looking at it as a way of more positive growth. And now we're able to do a little bit more with, substance use. And, now that that's incorporated in there, because our funding was purely MHSA. And back then it was purely geared towards mental health services. So now with the BHSA and it getting, combined with substance and mental health services, now we're looking at it as an extra, not an extra, but another added positive, growth, not just for the staff to be able to provide this, get these educational training, like we're going to be including, so myself and two other staff members are going to get trained on, oh God, I cannot think of but it's through substance use. It's Kellogg's, I think it is. I think it is the Kellogg's training. I could be wrong on that. Don't put me on that one. But we're getting, training so that we're able to provide these services. We don't do billable services through Medi-Cal. All of our funding is completely through Modoc County Behavioral Health's contractual agreement and other contract agreements that Sunrise incorporates or seeds, or how would you say, collaborates with, that we provide this. And sometimes it's not even monetary collaboration or agreements. It's still being able to bring that resource out here at a no cost to us or the community. Like, for instance, the Medi-Cal peer support specialist training, being able to do that collaboration with Painted Brain and other local community agencies at the time, that we were able to, provide that avenue for Medi-Cal peer support specialist, 11 to be exact, out here in our area. And then also IHSS, which is that in-home health services through Teach is a local agency here that's also a nonprofit, as well as Sunrise is a nonprofit. And we do get a lot of donations. So whether it be clothing, we do life skill classes. I'm sorry, I think I'm jumping on all kinds of different, but, but with the new developments and the whole changing of the funding and how BHSA funding brackets and where, wellness centers fit in. At one point in time, I do believe prior to August of 2025, they used to fit perfectly well in the FSP program, through the Welfare Institution Code. They used to fit perfectly in there. But as they have been changed, that has been changed as well as other, welfare institution codes or other codes have been changed. Now we're just looking, I was just saying, more creative ways to really fit into the buckets. And it's really empowering and really uplifting that our behavioral health director also sees that, no, this is community support that we cannot let go. It cannot go away, because it does not just help FSP clients or our clients per word. It also helps everyone within the community. And there's so we're just looking forward to all the good changes and all the positive changes that will happen, and being able to provide more services within our community and getting that help out there.
Thank you, Ida. Yeah, again, so much to be looking forward to, so many exciting things. I think in this work, we can often get focused on the areas that are discouraging or the obstacles. But thank you both for everything you shared, because it is such a good reminder that there's so much good happening in this field. So much to be grateful for, so much to be hopeful for. And yeah, we're just grateful for both of you being here today, for sharing and learn so much more about both of your agencies. We're always just inspired by your agencies. We love your agencies. We love the work that you're doing. And yeah, thank you. Thank you again both for being here. And to wrap up for our listeners, just some ways to continue to get involved. First of all, if you're in a rural region and you're not really sure kind of how to get started or where to get started, we would love to connect you with rural partners so we can continue this conversation about reaching rural areas. Other ways to get involved, we have our behavioral health transformation workshops. We are wrapping up our tour of California. We've been in Los Angeles, in Costa Mesa, in Oakland, in Red Bluff with Ida and Don, and we're about to finish in Sacramento. So we've loved getting to know everyone and expanding our community through those events. We do have a virtual event coming up. Our next training webinar will be on December 2nd, and that will be in partnership with the Happier Life Project and talking about substance use disorder in this work. We have our annual statewide conference coming up January 23rd, 2026. That will be held in Sacramento. And then monthly, we'll continue putting out these podcasts. So follow us, just stay tuned for different ways that you can get involved as we put out calls to action from time to time and share with you ways to advocate.
Thanks, Joss. Yeah, so like Joss just said, we do always provide calls to action. So we have a new advocacy platform that we're implementing. So if you're subscribed to our emails, please just keep a lookout for that. And thank you for joining us today. Please join us next month as we discuss best practices for interpretation and translation on our next episode. And we look forward to hearing from you as we start our new online polls soon. So we will see you all next time. Thank you. Bye.
Bye.
Bye, everyone. Thank you.
Bye.
Thank you.